The apical four chambers view shows another situation when the hypertrophy is mainly or only presented in the apex of the left ventricle. It's hypertrophic cardiomyopathy called Yamagushi disease. It's predominantly encountered in Oriental patients. There are no subaortic gradient in this case. This long X shows how the left ventricular cavity is occluded during systole, only in the apical region. A two-chamber TEE view showing the important hypertrophy only at the left ventricular apex. Frequently, Yamaguchi may not be noticed easily if there is too attenuation of the ultrasound at the hypertrophy apex. Then the use of microbubbles contrast may help to identify the intense apical hypertrophy. Here another example. In this case, the microbubbles showed the apical hypertrophy, and several vessels flow in this region during diastole. Here the same patient is studied with color Doppler. See the flow of the vessels in the hypertrophy apical region during diastole. Hypertrophic cardiomyopathy is familiar. It is autosomal and dominant with high penetration. In a family that we diagnosed the case of hypertrophic cardiomyopathy in this 28 years old woman, and then study the whole family, we can see the high penetration. The frequency of hypertrophic cardiomyopathy on the direct family is so high that we can use this fact to diagnose a patient whom we're not sure of the diagnosis. For instance, if we study this patient here and we're not sure about her diagnosis, statistically, if we study at least 5 direct relatives and not find any case of hypertrophic cardiomyopathy, the chance of that patient we had doubt to have the disease is minimal, less than 3%. But if we find only one of them with the typical case, then we can be sure that the patient we studied first was indeed with the disease.